In this video, I'm going to talk about different forms of congenital heart defects, and I would like to start with the type of defects that cause left to right shunting of the blood. So if we have the heart right here, and here would be the right atrium, right ventricle, left atrium, and the left ventricle. If we have a ventricular septal defect, then due to the increased pressure on the left side of the heart, there would be shunting of the blood from the left ventricle to the right ventricle. Similarly, if we have an atrial septal defect, then there would be a shunting of blood from the left atrium to the right atrium. And finally, if we have patent ductus arteriosus, and you know how pulmonary trunk is connected to the aorta via the ductus arteriosus. So since there is more pressure in the aorta, then there would be shunting of blood again from the left side to the right side, from aorta into the pulmonary trunk. So one point I would like to mention about these conditions is about their frequency. So VSD is by far more common than the other conditions, and it accounts for about 50% of all congenital heart defects. The second most common would be ASD, and then after that one it would be the PDA. Now the way I memorize it is vampire. So VAP, and then we have VAP. Now let's start with VSD and talk about the type of murmur, clinical symptoms, and causes that are associated with ventricular septal defect. So the kind of heart murmur that you hear on examination with VSD is a harsh holosystolic murmur. So harsh holosystolic murmur. And then since these patients develop pulmonary congestion as well as the increased blood flow into their left ventricle, then there would be congestive heart failure and respiratory infections that are associated with VSD. And common causes of VSD include fetal alcohol syndrome as well as the Down syndrome. The next condition is atrial septal defects, and it presents with a fixed split S2. So let me explain what I mean by that. So if you have the first heart sound S1 and then the second heart sound S2, S2 is divided into two sounds. One is the aortic closure valves. So when the aorta closes, that would be the first sound of S2, and then after that one the pulmonary valve closes, so that would be the second sound of the S2. So normally when someone takes a deep breath, because there would be more blood flow into the right ventricle and thus there would be more blood flow into the pulmonary vessels, it takes longer for the pulmonary valve to close, so this distance increases. In patients with ASD, however, the S2 split is fixed, so no matter whether you're taking a deep breath or not, the distance between these two sounds is fixed. So let's go back here. So with atrial septal defect, we have a fixed split S2, and these patients are usually asymptomatic. But depending on the size of the defect, they may develop congestive heart failure and respiratory infection. And similar to VSD, ASD is associated with fetal alcohol syndrome as well as Down syndrome. The next condition is patent ductus arteriosus, and the murmur is characterized by a continuous machine-like murmur, and these conditions cause dyspnea and congestive heart failure, and PDA is commonly associated with congenital rubella infection as well as prematurity. So it's very important. Remember that rubella is associated with patent ductus arteriosus. Now, if you've noticed here, we said late cyanosis, and I would like to discuss why these patients are developing late cyanosis. So initially, there is a left to right shunting of the blood. But as the blood volume in the right ventricle keep increasing, there would be more blood flow into the pulmonary vessel, and eventually they would develop hypertrophy. And so by developing hypertrophy, the pressure in these vessels increases, and thus eventually there would be switching of the blood flow from left to right to right to left. So there would be switching in here, and this phenomenon is referred to as Eisenmenger syndrome. And at this stage, these patients will develop cyanosis, plus nail clubbing, plus polycythemia. So just keep in mind, Eisenmenger syndrome is when the left to right shunting turns into right to left shunting, and this condition is seen in PDA, ASD, and VSD. Alright, now that we are done with these explanations, let's go through this table and summarize what I just explained there. So the type of congenital heart defects that are associated with late cyanosis due to Eisenmenger syndrome include ventricular septal defect, atrial septal defect, and patent ductus arteriosus. And since the cyanosis will develop later in life, these patients are referred to as blue kids. And so ventricular septal defect presents with a harsh holosystolic murmur that is commonly seen with fetal alcohol syndrome and Down syndrome. Atrial septal defect presents with a fixed split S2, and that's very important. These patients are usually asymptomatic, and similar to VSD, they're associated with fetal alcohol syndrome and Down syndrome. And finally, patent ductus arteriosus, which presents with a continuous machine-like murmur and is commonly seen with congenital rubella infection. Now, the other type of congenital heart defects that I would like to talk about are the ones that are causing right to left shunting. And since these are already beginning with right to left shunting, therefore they would be early cyanosis, and thus these patients are referred to as blue babies. So the first condition that I would like to talk about is transpositions of the great vessels. But before I do that, I would like to discuss the normal embryonic development of the heart. So you know how we have the heart here, and then Truncus Arteriosus is leaving. When the aorticopulmonary septum comes in here, it would rotate in a spiral fashion, and thus by doing that, the aorta will leave the left ventricle, while the pulmonary artery will leave the right ventricle. And so aorticopulmonary septum develops in a spiral fashion. Now, if there is failure for this aorticopulmonary septum to develop in a spiral fashion, what you can imagine is that Truncus arteriosus will have an aorta that is coming out of the right ventricle versus a pulmonary artery that is coming out of the left ventricle. So there would be transposition of the great vessels. And this condition is incompatible with life unless there is some other form of defects like atrial septal defects or patent ductus arteriosus, which allows the deoxygenated blood to mix with the oxygenated blood. So let's go over that again. Transposition of the great vessels is caused by the failure of the aorticopulmonary septum to develop in a spiral fashion, and these patients usually develop with cyanosis immediately after birth, and that's very important. So as soon as they're born, they start to develop cyanosis. And common causes of transposition of great vessels is infant of diabetic mother. So diabetic mother. The next condition is Tetralogy of Fallot, which is caused by the failure of the aorticopulmonary septum to align properly. And so again, you know how we have the Truncus Arteriosus, and then it gives rise to aorta and the pulmonary artery. Now what happens is that if the aorticopulmonary septum is misaligned, and thus there would be an overriding aorta with a stenotic pulmonary artery. So here we have a stenotic pulmonary artery. And since there is stenosis of the pulmonary artery, there will be right ventricular hypertrophy. And so right ventricular hypertrophy. And the final condition that is associated with Tetralogy of Fallot is the ventricular septal defect. So let's go over that again. So this condition is associated with overriding aorta, pulmonary stenosis, ventricular septal defect, as well as right ventricular hypertrophy. One important clinical finding is called TET spell. So following exertion, these patients will develop cyanosis, and they feel much better after they do squatting. And the reason for that is that squatting increases the pressure in the systemic circulation. So there would be increased systemic pressure, as a result of which more blood would flow into the pulmonary vessels, and so oxygenation would improve. So these patients will benefit from squatting and they feel better, and this is referred to as TED spell. And Tetralogy of Fallot is commonly seen with DiGeorge syndrome, which is caused by the failure of development of the third and fourth branchial pouch. The last condition I would like to talk about is persistent Truncus Arteriosus, and this is caused by the partial development of the aorticopulmonary septum, and thus there would be a part of this trunk that has both aorta and pulmonary artery mixing blood together, and so this condition is causing dyspnea and congestive heart failure, and similar to Tetralogy of Fallot is commonly seen with DiGeorge syndrome. Now I would like to summarize these findings. So conditions that are causing right to left shunting are causing early cyanosis, and since they are causing early cyanosis, they are referred to as blue babies. The first condition is transposition of the great vessels, which is by the failure of the aorticopulmonary septum to develop in a spiral fashion. And one important clinical finding is that these patients develop with cyanosis immediately after birth, and transposition of great vessels is seen commonly in infants of diabetic mother. The next condition is Tetralogy of Fallot, which due to the misplacement of the aorticopulmonary septum, there would be an overriding aorta with pulmonary stenosis, as a result of which there would be right ventricular hypertrophy, and the final condition that is associated with it is a ventricular septal defect. Now these patients feel better after they do squatting, and the reason for that is that it increases systemic blood pressure, so there would be more blood flow into the pulmonary vessels, and thus the oxygenation improves. So these patients feel better after squatting. And Tetralogy of Fallot is commonly associated with DiGeorge syndrome. And the final condition is Truncus Arteriosus, which is caused by the partial development of the aorticopulmonary septum, and this condition, again similar to Tetralogy of Fallot, is commonly associated with DiGeorge syndrome. And that concludes our discussion.